Hello, everyone. It's Dave again. I'm haven't been able to keep up with my anticipated regular schedule of updates, but um, a lot of things have happened in the meantime, and so you'll be finding out about that in the next couple of minutes. Um, but it's now post-op day 10 from my surgery, week and 3 days, and I can tell you that the pain is much better. I'm able to ambulate with a cane or a walker um, without assistance. I can go up and down stairs on a limited basis. Um, uh, so it's much better than it was the last time I updated you. Um, while we were in the hospital, it's important to note that you have uh, devices on your legs called sequential compression devices. And they put these on in the preoperative area, and they leave them on throughout the operation and throughout your hospitalization. And they're designed to uh, sequentially squeeze and relax on your calves and your legs to improve the venous circulation. Uh, Years ago, when these were not as prevalent as they are now, patients would tend to get circulatory disorders in their lower extremities, uh, blood clots. It's been referred to. It's actually called deep venous thrombosis. And when these were not in such plentiful use in the old days, it was not unusual for patients to get deep vein thrombosis. Anyway, we used these in the hospital, and I knew that they were going to be doing that. Um, in some cases, for certain types of surgery, additional measures include medications, specifically um, medications on a daily basis to assist in um, reducing the risk of deep vein thrombosis. Now, these medications are also uh, put patients at slightly increased risk for bleeding, so the surgeons have to weigh the benefits versus the risks of doing these, adding these types of medications to the regimen of the sequential compression devices and the stockings. I'm telling you all this because um, we did all these measures, and the medications for the use of antithrombotic events was not used because of the risk of bleeding after surgery. So we went home on the seventh postoperative day. It was a 4-hour flight. Um, and the next day I started developing some pain in my left leg, my left calf area. Um, I measured the circumference around my calf, which is one of the first things that we do to try to determine whether patients have a problem with deep vein thrombosis, or DVT. And there was no increased swelling in my leg, just a soreness, so no discoloration. So I kept an eye on it. The next day, there was no question that I had a deep vein thrombosis. The foot and lower calf areas were markedly swollen. There still was no discoloration in the skin, but there was no question about it. So we went promptly to the local hospital and had the definitive test, which is an ultrasound examination of the lower extremities. It's a Doppler color flow analysis of the blood flow in your legs. It's not an angiogram. It's just done with an ultrasound device, but they can tell whether or not there are blood clots in the veins, and they found early evidence that this was a deep vein thrombosis in the early stages. So it's important to recognize the warning signs and make sure that you, if this happens to you, you bring it to someone's attention very quickly, because it can be a very serious thing. So I'm on an additional medication now called Xarelto, which is a new medication. Used to be that they would have to put patients on Coumadin or even heparin in some bad cases. But the new medication now is frequently used is called Xarelto, and I'm going to need to be on that for 3 to 4 months to make sure that this blood clot is dissolved and there's not going to be any further problem from it. I'm also on compression stockings and leg elevation, which is a little bit of a problem now because I can't continue to do my progressive ambulation with the back therapy, but I've got to keep my leg elevated to keep the swelling down and to encourage the resolution of the deep vein thrombosis. I wanted to show you my scars now that they're a little bit healed up and the swelling has gone down a little bit. So I'll switch the camera over to do that. My procedure was a minimally invasive L4, L5 fusion. You see the two scars side by side, about 1.5 inches long. And then there's a third scar a little bit lower that is used for a spinal cord monitoring during the procedure. So I'm continuing to use the back brace when I'm standing and moving about. Using the ice packs less and less now because the swelling is pretty much diminished. So I don't think that those ice packs are going to be much benefit to me beyond that. They do make it feel a lot better, but I don't have to continue that for a long duration. So anyway, that's the latest update. I'll try to keep you updated now on a weekly basis, or if any things happen that would be of interest to you as you consider this operation for yourself. My complication of the deep vein thrombosis is not something that you should necessarily really cancel your plans for this. It's one of the known complications of it, and it's an inconvenience, and it's going to be, you know, some changes in the post-operative recovery phase and the post-operative therapy, but it's not the end of the world by any means. It's not like a wound infection or something like that, which would be considerably more a significant problem than the DVT. But we'll get through it, and talk to you soon.